Did you know that the risk of having an infection in the United States from a spinal surgery is about 3%? If a patient has an infection after surgery, it can lead to more time in the hospital, maybe another surgery, and sometimes long-term IV antibiotics, 6 weeks or more. So infections can be a major setback in the recovery from surgery. Let's talk a little bit about how we can prevent post-surgical infections. The first set of things that I wanted to discuss are things that you can do to prepare yourself for surgery from the perspective of preventing infection. Activity and nutrition are very important. Nutrition especially. The body needs protein, minerals, and other vitamins to heal the tissues. And if it doesn't have those, the healing can be affected, the wounds can break down, and the body's ability to fight an infection is decreased. So consider meeting with the dietitian before surgery and maximizing your nutritional status going into surgery. It's known that medical comorbidities increase the risk of infection. Specifically, diabetes is one. We want the hemoglobin A1C to be less than 7 and the blood sugars to be well controlled. Also, high blood pressure, managing and controlling blood pressure. Any other medical conditions that you may have, you want to get to a point where you're managing those medical conditions as well as possible. Smoking can have a negative effect, and patients that quit smoking, even a few weeks before surgery, have a lower rate of complications from that surgery, including infection. Finally, body mass index. We want the patients to have a body mass index ideally less than 40, but still have good nutrition. This doesn't mean that we're starving patients just to get the body mass index down. It is known, though, that a higher body mass index leads to a higher risk of infection. Let's talk a little bit about prophylactic antibiotics. The World Health Organization and the United States Centers for Disease Control and Prevention recommend using an antibiotic IV basically right before the incision is made. They also do not recommend using antibiotics routinely after surgery. So what we do is we typically give a medication called cefazolin. There's a couple of other options if there's an allergy or an intolerance to cefazolin, right before skin incision. If the surgery is lasting more than about 4 hours, we would redose that antibiotic. We don't, however, give post-operative antibiotics. And I've discussed this with our infectious disease colleagues and looked through the literature. There really is no strong evidence for routine use of post-operative antibiotics. And there can be some downside in having patients on longer-term antibiotics. So we use the single dose of IV cefazolin before we make our incision. If patients prepare themselves for surgery, and we do good surgical technique, good sterile technique, in combination with the IV dose of antibiotics, I think we can keep our surgical infections low. I don't think we'll ever get to be 0%, but we can make it lower than 3% and fortunately avoid having too many post-operative infections.